Good morning, everyone. Thank you so much for joining us today. We're excited to have you all here. We're going to be going over some of the particulars about the RFA process for co-creating well-being. We're going to leave plenty of time at the end to answer your questions. So you can submit those through the questions function, or you can raise your hand. We're happy to answer those questions. Please feel free to ask them at any point, but there will be time at the end specifically for questions. I can't see. Okay, so just to go over the process and the timeline, applications are going to be due April 17th by 4 p.m. So that's 6 weeks. And during this time, all of the questions that have to be included in the application are in the document that I sent out when I notified all of you that you were being invited into the next phase. And part of that is the ideation and prototyping. That's a big component of what we hope that you have been engaging in and will continue to do over the next 6 weeks, which is talking to your clients, finding out what they see as the primary needs, and getting some feedback about possible solutions. So we're going to talk a little bit more about that, but the timeline is there's 6 weeks before the deadline, and we're also going to talk a little bit about the stipends and the deliverables for organizations that are interested in applying for that. So just to recap where we are, most of you should be pretty familiar with this, so I'm not going to spend a ton of time here. We spent some time at the beginning doing human-centered design training, so the one-day workshops on trauma-informed care and human-centered design. Then over the last year, it was really continuing to dig in and learning more about human-centered design, collecting insights from the community. Those insights were then turned into the insight report. We strongly encourage all of you to review that report again as part of your application and read it and hear what community members had to say about the needs that they have around trauma. And now we're into this third phase, which is action through grants. Everyone who's in the webinar today submitted an LOI, and we're excited to share feedback with you individually about that. And I'll be reaching out to all of the organizations in the next day or so and asking you to schedule some time for a phone call to get some feedback and discuss where your proposals might go from here. So during the next 6 weeks, you have to engage in some kinds of ideation, prototyping, and testing activities. The goal of these activities is to continue to improve, refine, redesign, and adapt the programs and strategies that you're thinking about implementing. By the end of this 6-week period, hopefully you'll have a good idea of what you're planning to do for the next 2 years, which is our implementation phase, what you'll need to do during your 3-month planning phase in order to get ready to begin implementation, and how much it will cost in order to be able to do this. So what's available as a starting point? There's lots of different ways you can approach ideation and prototyping. There are tons of resources on the Co-Creating Wellbeing website. We strongly encourage you to take advantage of those resources. The ideation and prototyping webinars are available. You can review the webinars, take a look at the activities. There are lots of resources. But these are not the be-all and end-all. They're not exclusive. If you have other ideas about possible prototypes, ways that you want to go about ideation and prototyping, you are encouraged to do that. These are not exhaustive. They're just helpful starting points. The questions in the RFA application are really going to be focused on these ideation and prototyping activities. They're a key component of this process. We're interested in what are the key reflections, observations, and findings from your team's efforts to develop the RFA submission. What did you learn from ideation? How did talking to your clients change your understanding of what solutions might be possible or might be needed? And then what did you learn from prototyping? So how did your initial understanding of solutions change when you went back and presented them to your clients again? The program design piece is really around what do you think you want to do? And how did this come out of your ideation and prototyping activities? So we really want to see the connection between your use of the human-centered design tools and what you come up with. We're also interested in other kinds of information and resources that you've used to inform the design of this program or service. So is this an evidence-based program that you're modifying? Is it a previous service that you had that you're redesigning? What kinds of research and experience and information informed the design of this program and service? What are the trauma-informed care best practices that you've used to design this project? So things like mindfulness perhaps could be a best practice that may come into play for some of your work. And then we also really want to know how you're going to ensure that your work is actively incorporating the principles of diversity, equity, and inclusion. How are you going to make sure that you're paying attention to issues of access and inclusion of underrepresented voices? So to continue to review the questions that are going to be asked of you in the RFA phase, how is this an improvement over prior programs and services? What's better? What's different? And this is very critical. How are you going to continue to iterate? How are you going to continue to collect feedback from the end users, whether they're children, families, or service providers? And how are you going to continue to incorporate that feedback? What is the result that you want to see? Who will it benefit? So this is really, what are your goals? What are the outcomes that you're looking for? And what is your target population? This is really an RBA framework here, and there are some resources in the PDF that will give you a starting point on RBA. So it's RBA, for those of you who haven't looked it up, is, which maybe a lot of you, is results-based accountability. And it's just a framework of thinking about outcomes, and it's a results-oriented framework for evaluating programs and services, and can be used for continuous quality improvement. So this is the framework that we'll be using with all of you and providing some technical assistance and training on for the grantees who are funded. So this is how we will be helping you to continually evaluate and improve the programs and services you design. So these next questions continue to be from an RBA framework, which is, what is the story behind this? What's the story behind the curve? What are the barriers that are preventing better results? What is getting in the way of improving health outcomes? What do you know about these barriers? What geographical area will your design or improvement serve? Just as a reminder, the foundation serves these 16 counties of Western and Central New York. So all of you serve those counties, but we're interested in kind of specifically what's the geography of your service area. To get into some of the technical submission requirements, the application page, cover page is the same as what you submitted with the LOI, with organizational information, contacts. There's a 6-page maximum, 12-point font. We are not picky about font, so any standard font, Arial, Times New Roman, no Comic Sans, please. And then there is a budget template that I will make sure that everybody gets sent that. I'm not sure if there's a link to it in the PDF, but if there isn't, it'll go out. And then there's a little checklist. So your project budget template, your application narrative, the form, the cover sheet with the contact information, and the signature of your executive director. All of that will come to us via email, co-creating wellbeing, CCWB at hfwcny.org by 4 p.m. on Friday, April 17th. So the optional component here, in addition to the things that you have to submit, you have an option to submit some deliverables around your ideation and prototyping. You are strongly encouraged to produce records of the decisions that you make, the client notes, the reflections, the prototypes that you build and test. You don't have to submit those to us, but if you do, we are providing stipends to support engaging in these ideation and prototyping activities. If you submit all the components for ideation, you'll be eligible for a $500 stipend and $500 for the prototyping and testing deliverables. So on the next slide here, we have some guidelines about what the deliverables are. So the outputs are pictures of the results. So for ideation, that would be maybe pictures of the sticky note clusters. For prototyping and testing, that would be a sample prototype, a storyboard, a floor plan, a diorama, something to give us a sense of what the outputs were from your ideation and prototyping sessions. We also would like to see some reflections. So the engagement guide on our website has a starting point that you can use for ideation. Feedback grids should be pretty familiar. Those are also available. Some kind of evidence of client feedback and improvement. And then we want some next steps. So we're interested in knowing how you're going to take the ideas that you've settled on and turn them into prototypes when you're in the ideation phase, and how will participants be engaged. And then for the prototyping phase, what are the next steps for developing the prototype? How can participants continue to give feedback and be involved? And these questions should look pretty familiar. They are heavily overlapping with what you'll be writing for the RFA anyway. So if you submit those deliverables to us along with your application and your W-9, as long as you've completed those pieces, you'll be eligible for the stipends. So it's a lot of information. We're happy to take some questions. Again, there's a question function and a hand raising function here. We're going to go through a couple questions here. So the grant amounts, it says in the document 50,000 to 150,000 over the 27-month time period. We will accept proposals that are under 50,000. So if you have a great idea and it's low cost, that's fantastic. We want to hear about it. You don't have to hit that $50,000 threshold. So the question is, if the ideation and prototyping deliverables are related to work in phase 2 or work in phase 3 with the proposed project. So these, the ideation and prototyping should really be connected to the insights that you've gathered and the insights report that is on the website. And they may be related to some of the ideas that you shared with us in phase 2 around what you're hearing from your clients about needs. But they should really be, this should be new work that you're doing during the next 6 weeks and really leading into the prototypes that you're proposing and the solutions that you're suggesting in your application. They should be connected, but it is work that we're asking you to do over the next 6 weeks. Yeah, it's new work. A couple people asked about copies of this presentation. Yes, I'm going to send out information about the deliverables related to the stipends, as well as some other information that may be helpful, and it will be online. This presentation will also be is also being recorded and will be online. Someone else asked, when will you find out if the application is successful? So we will be notifying applicants by June 30th. So another question was around the ideation and prototyping has to be done in the next 6 weeks. That's a component of your application. Then successful applicants, grantees who are funded, will have 3 months to continue to develop their prototypes and to lay the groundwork and engage in some additional planning. So there is a 3-month planning period built into the grant, but ideation and prototyping is to be done in the next 6 weeks as part of your application. So we had a few more questions about ideation and prototyping. There's about how many clients need to be involved. There's no target number of clients for either ideation or prototyping, but more is always good. So the more people that you talk to, the more diverse feedback that you get, the better your ideas and feedback are likely to be. However, a smaller amount of really high quality engaged feedback is better than a lot of, than more shallow feedback that doesn't really get at the ideas that you're presenting. Written records are always good, and those are going to be helpful for looking back and making sure that you understood the feedback that was provided. Another question around ideation and prototyping, whether they have to be done as a workshop. No, they don't. There are lots of ways to engage clients in ideation and prototyping. Workshops are one way, but they are not the only way. We're going to give everybody a few minutes if you have any additional questions, but we will share these slides and the recording of the webinar. So we have a couple more questions. One around the availability of the technical assistance team to help with ideation and prototyping. No, they are not available for consultation at this point. However, the webinars that they did on ideation and prototyping are incredibly comprehensive, and those are up on the website. We strongly encourage you to watch them. And all of those tools, so there was a question about the adult journals, postcards, etc. Those tools are also available on the website. You can print as many copies as you want. So hopefully we strongly encourage you all to take advantage of those resources that are up on the website. The website has a lot there around human-centered design. So we had another question about site visits. Yes, but probably not at this phase. So it will depend a little bit. So organizations that submit the RFA, it is likely that we will schedule site visits at that point. Site visits will be after the RFA submission during the review phase. There was a question about the scheduling for this webinar. We apologize. We had internally decided to have webinar early to make sure that all organizations had as much time with the information as possible, and it was a typo in the PDF document. We didn't correct that, so we apologize. If necessary, we can continue to provide more information, and this webinar will be recorded and up on the website, but there are not any other date changes anticipated. If there are any additional questions, please send them to ccwb@hfwcny.org. We do have the next steps here for you, which is the LOI follow-up calls, which I will be scheduling. Please feel free to reach out if you have questions. The questions from the webinar will also be included in the frequently asked questions, which is, as always, up on co-creatingwellbeing.com. The next step, of course, is the RFA submission, which is April 17th, 4 p.m., same email address. And then site visits will happen after the RFA submission in May. So thank you all so much for your time this morning. We really appreciate it. We're so excited to have all of you joining us in the phase of this project, Action Through Grants. You know, this is a wonderful opportunity to expand the range and availability of trauma-informed care services that are so badly needed in our community. And we're really excited about the work that everyone's been doing. So thank you so much for joining us. Have a wonderful morning, and we look forward to hearing from you.